Malaria is the most common and widely known mosquito-borne disease that affects millions of people every year, especially in tropical and subtropical regions. It is transmitted from person to person when an infected female Anopheles mosquito bites and injects its saliva into the bloodstream of its prey. Malaria is a protozoan disease that is caused by a parasite called Plasmodium, which has 5 species that can infect humans, namely, Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium knowlesi. Of all the 5 species, Plasmodium falciparum is the most dangerous. Malaria can either be uncomplicated or severe, depending on the type of Plasmodium, the level of immunity of the infected person, and the presence of other factors, such as pregnancy, malnutrition, or co-infections. Uncomplicated malaria is a mild form of malaria that is caused by any species of Plasmodium and can be treated with oral drugs. On the other hand, severe malaria is a life-threatening form of malaria that is usually caused by Plasmodium falciparum and requires urgent hospitalization and intravenous drugs. Therefore, before treatment commences, it is very important to first have a laboratory test done on a malaria patient in order to know the causative parasite, the level of red blood cells and platelets, as well as the level of functionality of the liver and the kidney. This is to ensure that the appropriate treatment or medication is prescribed. The symptoms of malaria usually appear between 7 to 30 days, depending on the Plasmodium species. The symptoms include headache, limb and back pain, fever, chills, profuse sweating, loss of appetite, anemia, jaundice, fatigue, muscle pain, swollen and tender spleen, nausea and vomiting, and general weakness of the body. In severe cases, malaria can also cause respiratory failure, kidney failure, severe anemia, low blood sugar, low blood pressure, shock, confusion or delirium, cerebral malaria, seizures, and coma. Malaria is treated with anti-malarial medications, as recommended by a qualified healthcare provider. The earlier the treatment, the better the outcome, especially in the case of severe malaria, in which complications such as the blockage of the small blood vessels of vital organs such as the brain can occur, and ultimately lead to death. After a proper diagnosis, the type of medications the doctor will recommend for the treatment of malaria depends on several factors, such as the type and severity of malaria, the age and weight of the patient, the pregnancy status of the patient, the drug-resistant status of the parasite, and the availability and cost of the medications. Some of the commonly used anti-malaria drugs include 1. Chloroquine. This is a drug that has been used for decades to treat uncomplicated malaria that's caused by Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, or sensitive strains of Plasmodium falciparum. It is sometimes combined with chlorphenamine, commonly known as Piriton, for patients who experience itchiness when they take chloroquine only. However, chloroquine is not effective against resistant strains of Plasmodium falciparum that are prevalent in many parts of the world. Chloroquine can cause side effects such as nausea, vomiting, headache, blurred vision, and skin rash. It can also worsen psoriasis or porphyria in some patients. 2. Doxycycline. This drug belongs to the tetracycline group of antibiotics, and can be used to treat uncomplicated malaria that's caused by any species of Plasmodium, in combination with other drugs such as quinine or artesunate. Doxycycline can also be used as a prophylactic drug, to prevent malaria in travelers who are visiting areas where chloroquine-resistant Plasmodium falciparum is common. Doxycycline can cause side effects such as nausea, vomiting, diarrhea, increased sensitivity to sunlight, and yeast infection. It can also interfere with the effectiveness of oral contraceptives, or anticoagulants in some patients. Doxycycline should not be used by children under 8 years of age, pregnant women, and nursing mothers. 3. Hydroxychloroquine. This drug is similar to chloroquine, but has less toxicity and more efficacy against resistant strains of Plasmodium falciparum. It can be used to treat uncomplicated malaria caused by any species of Plasmodium, or as a prophylactic drug to prevent malaria in travelers who are visiting areas where chloroquine-resistant Plasmodium falciparum is common. Hydroxychloroquine can cause side effects such as nausea, vomiting, headache, blurred vision, and skin rash. It can also worsen psoriasis or porphyria in some patients. Hydroxychloroquine should be used with caution in patients with liver problems, kidney problems, or glucose 6-phosphate dehydrogenase deficiency. 4. Clindamycin. This drug belongs to the lincosamide group of antibiotics, and can be used to treat uncomplicated malaria caused by any species of Plasmodium, in combination with other drugs such as quinine or artesunate. Clindamycin can also be used as an alternative to doxycycline, for prophylaxis or treatment of malaria in children under 8 years of age, pregnant women, and nursing mothers. Clindamycin can cause side effects such as nausea, vomiting, diarrhea, abdominal pain, and allergic reactions. It can also cause pseudomembranous colitis, a serious infection of the colon, in some patients. 5. Mefloquine. This is a drug that belongs to the quinoline group of antimalarial, and can be used to treat uncomplicated malaria caused by any species of Plasmodium, or as a prophylactic drug, to prevent malaria in travelers who are visiting areas where chloroquine-resistant Plasmodium falciparum is common. Mefloquine can cause side effects such as nausea, vomiting, dizziness, headache, insomnia, nightmares, and mood changes. It can also cause cardiac arrhythmias, or neuropsychiatric disorders, such as anxiety, depression, psychosis, and seizures in some patients. Mefloquine should not be used by patients with heart conduction disorders, or a history of psychiatric or neurological problems. 6. Atovaquone. This is a drug that belongs to the hydroxynaphthoquinone group of antimalarial drugs. It can be used to treat uncomplicated malaria caused by any species of Plasmodium, in combination with another drug called proguanil. Atovaquone can also be used as a prophylactic drug, to prevent malaria in travelers who are visiting areas where chloroquine-resistant Plasmodium falciparum is common. Atovaquone can cause side effects such as nausea, vomiting, diarrhea, abdominal pain, and skin rash. It can also interact with, or reduce the effectiveness of other drugs such as tetracycline, rifampin, or metoclopramide. Atovaquone should not be used by pregnant or nursing women, as well as patients with kidney problems. 7. Artemether and lumefantrine. This is a combination of two drugs that belong to a group of antimalarial drugs known as artemisinin-based combination therapy (ACT). It can be used to treat uncomplicated malaria caused by any species of Plasmodium, especially Plasmodium falciparum. Artemether and lumefantrine can cause side effects such as nausea, vomiting, diarrhea, headache, dizziness, palpitations, and cough. It can also interact with other drugs such as rifampin, erythromycin, ketoconazole, or nevirapine, and alter their levels in the blood. Artemether and lumefantrine should be used with caution in patients with liver problems, kidney failure, and heart conduction disorders. 8. Sulfadoxine and pyrimethamine. This is a combination of two drugs that belong to the sulfonamide and dihydrofolate reductase inhibitor groups of antimalarial drugs, and can be used to treat uncomplicated malaria caused by Plasmodium falciparum or Plasmodium vivax. However, this combination is not recommended for routine use, because of the high prevalence of resistance and the risk of severe adverse reactions. Sulfadoxine and pyrimethamine can cause side effects such as nausea, vomiting, diarrhea, skin rash, anemia, low white blood cell count, low platelet count, and hypersensitivity reactions, such as Stevens-Johnson syndrome or toxic epidermal necrolysis. It can also interact with other drugs such as warfarin, phenytoin, or methotrexate, and increase their toxicity. Sulfadoxine and pyrimethamine should not be used by pregnant women, nursing mothers, or patients with kidney problems. It is important to understand that many antimalarial medications serve both as preventive and curative treatments. When a complete dosage of these medications are taken as prescribed by a qualified healthcare provider, individuals are protected, or temporarily immune to malaria for about 4 weeks. After this period, they become vulnerable to the malaria parasite again. However, it should be noted that antimalarial medications that are taken for prophylactic reasons can sometimes delay the appearance of malaria symptoms by weeks or even months, and this can lead to the problem of delayed diagnosis, misdiagnosis, and late treatment. Therefore, travelers are advised to go for malaria test immediately after returning from their trips, to avoid the risks of health complications that can arise as a result of untreated malaria infection. More importantly, Antimalarial drugs should only be taken as prescribed by a qualified medical doctor, following an accurate diagnosis or recommendation in regard to prophylactic use. Moreover, infected pregnant women should always consult with their doctor before taking any medication, and they should be promptly and properly treated, so as to avoid complications before or during childbirth. Yellow fever is a viral disease that is caused by a virus called the yellow fever virus, YFV, which belongs to the family Flaviviridae. The disease is endemic in South America and tropical Africa, where it causes outbreaks every few years. Yellow fever is originally a disease of the monkeys that live in the rainforest, and it is transmitted from monkey to monkey, or from monkey to human, or from human to human, by Aedes and Haemococcus mosquitoes. Yellow fever can be mild or severe, depending on the amount of virus in the blood and the response of the immune system. Mild yellow fever causes flu-like symptoms that usually resolve within a week. On the other hand, severe yellow fever causes damages to the liver, kidney, and other organs, resulting in jaundice, internal bleeding, kidney failure, and shock. Severe yellow fever can be fatal, if not treated promptly and properly. The symptoms of yellow fever usually appear within 3 to 6 days, after being bitten by an infected mosquito. The symptoms can be divided into 2 phases, namely, the acute phase and the toxic phase. The acute phase lasts for about 3 to 4 days and causes discomforts such as fever, headache, muscle pain, backache, loss of appetite, and nausea and vomiting. About 15% of patients who recover from the acute phase enter the toxic phase within 24 hours. The toxic phase lasts for about 2 to 3 days, and causes symptoms such as high fever, jaundice, abdominal pain, bleeding from the nose, gums, or eyes, black vomit, shock, and coma. The toxic phase has a mortality rate of about 50%, and the patient can die within 10 to 14 days. Survivors of the toxic phase usually recover completely within a few weeks. There is no specific antiviral treatment or cure for yellow fever. The treatment is mainly supportive, and aims to relieve the symptoms and prevent complications. The treatment may include 1. Adequate rest and fluids, to prevent dehydration. 2. Acetaminophen, commonly known as paracetamol, to reduce fever and pain. 3. Blood transfusion, to replace lost blood. 4. Oxygen therapy, to improve breathing. 5. Dialysis, to support kidney function. 6. Antibiotics, to prevent secondary bacterial infections. The best way to prevent yellow fever is to get vaccinated, especially if you are traveling to areas where the disease is endemic or epidemic. The yellow fever vaccine is safe, effective, and provides lifelong immunity after a single dose. The vaccine should be administered at least 10 days before travel, and should be recorded in an international certificate of vaccination. The vaccine is not recommended for children under 9 months old, pregnant women, nursing mothers, and people with severe allergies or immune disorders. Other ways to prevent yellow fever include using insect repellents, wearing protective clothing, and sleeping under mosquito nets so as to avoid being bitten by mosquitoes. Filariasis is a group of parasitic diseases that are caused by thin and white thread-like filarial worms called filariae, which live in the lymphatic system, the subcutaneous layer of the skin, or the serous cavity of the abdomen. These parasitic worms can be found in Africa, some parts of South America, the subtropical parts of Southern Asia, and the South Pacific. Filariasis is transmitted by blood-feeding insects that carry the worms from one person to another. There are 3 different types of filariasis, depending on where in the body the worms reside, namely, lymphatic filariasis, subcutaneous filariasis, and serous filariasis. Out of these 3 types, only lymphatic filariasis is transmitted by mosquitoes, while subcutaneous and serous filariasis are spread by other insects such as midges, black flies, mango flies, and deer flies. Subcutaneous filariasis primarily affects the subcutaneous layer of the skin, resulting in symptoms such as skin rashes, itching, nodules under the skin, eye lesions, blindness, joint pain, and fever. On the other hand, serous filariasis affects the serous cavity of the abdomen, leading to abdominal pain, organ damage, and fluid accumulation, medically known as ascites. Regarding mosquito-borne filariasis, the species of filarial worms that are responsible for lymphatic filariasis are Wuchereria bancrofti, Brugemalae, and Brugiatomori. The transmission of the disease varies across different regions, with Anopheles mosquitoes being the primary vectors in Africa, Culex quinquefasciatus in South America, Mansonia in Asia, and Aedes in the Pacific Islands. The transmission cycle of lymphatic filariasis begins when a mosquito vector sucks up a large number of immature filarial worms called microfilariae, while feeding on an individual, who hosts the adult worms in their body. The microfilariae develop into mature worms inside the mosquito for about a month, after which they are ready to infect another person during a blood meal by their vector. The mature worms mate and produce more microfilariae inside the human body, completing their life cycle. It takes several months of repeated bites and reinfection for lymphatic filariasis to develop. The disease affects the lymphatic system by inflaming and obstructing the lymphatic vessels, which can lead to fluid retention, lymphedema, and skin or tissue thickening of the limbs, genitals, breasts, or face, a condition commonly known as elephantiasis. Chronic lymphatic filariasis can result in permanent disability and disfigurement. People who have lymphatic filariasis do not develop any visible or uncomfortable symptoms that could alert them to the presence of the disease in their body, until several months or even years after infection, when physical symptoms begin to appear, an indication that the disease is now in the chronic phase. The physical symptoms of lymphatic filariasis vary depending on the organ affected, which may include 1. Swelling of the limbs, breasts, or face. 2. Swelling of the scrotum in men, known as hydrocele. 3. Bacterial skin infections. 4. Thickening of the skin and the underlying tissues. 5. Elephantiasis. Lymphatic filariasis can be treated with antiparasitic drugs that kill the adult worms and the microfilariae, as prescribed by a qualified healthcare provider. The most commonly used drugs are diethylcarbamazine, ivermectin, and albendazole. These drugs are usually administered in combination, or in mass drug administration (MDA) programs, to eliminate the disease from endemic areas. The drugs can cause side effects such as nausea, vomiting, headache, dizziness, and allergic reactions. The drugs can also cause reactions in patients who have a high number of microfilariae in their blood, such as fever, chills, rash, swelling, and shock. These reactions are due to the release of toxins from the dying worms, and can be prevented by taking antihistamines or steroids before or after the treatment. The drugs should only be taken if prescribed by a qualified medical doctor. However, they should not be taken by pregnant women, nursing mothers, and patients with liver or kidney problems. The treatment of lymphatic filariasis should be accompanied by supportive care such as compression bandages, elevation of the affected limbs, skin care, exercise, and surgery, to reduce swelling and improve the quality of life of the patients. The best way to prevent lymphatic filariasis is to avoid mosquito bites, by using insect repellent, wearing protective clothing, and sleeping under mosquito nets. Dengue fever is a viral disease that is also known as break-bone fever. The disease is caused by a flavivirus, called the dengue virus (DENV), which has 4 serotypes, namely, DENV1, DENV2, DENV3, and DENV4. The virus is transmitted by female mosquitoes of the genus Aedes, especially Aedes aegypti and Aedes albopictus. Dengue fever is endemic in tropical and subtropical regions of Asia, the Americas, the Pacific Islands, the Middle East, and Africa. The disease can range from mild to severe, depending on the immune status of the infected person and the strain of the virus. Mild dengue fever causes flu-like symptoms that usually resolve within a week. On the other hand, severe dengue fever can cause hemorrhagic fever (DHF) or dengue shock syndrome (DSS), which are characterized by plasma leakage, bleeding from various organs, multiple organ failure, and shock. Severe dengue fever can be fatal if not treated promptly and properly. People with immune problems, or those who are already infected with one strain of the virus, are more prone to severe dengue fever if they get infected with another strain of the virus. The symptoms of mild dengue fever usually appear within 4 to 7 days, after being bitten by an infected mosquito. The symptoms can last for about 2 to 7 days, and may include sudden high fever, severe pain in the joints and limbs, serious headache, nausea and vomiting, loss of appetite, pain behind the eyes, red rash all over the body, and general weakness of the body. The symptoms of severe dengue usually appear after the initial fever subsides, usually within 3 to 7 days after infection. The symptoms can last for about 1 to 2 days and may include persistent high fever, severe abdominal pain, liver enlargement, swollen stomach, weak but fast pulse, breathing difficulties, cold and clammy skin, lymph and blood vessel damage, blood vomiting, persistent vomiting, nose bleeding, bleeding gums, bleeding under the skin, easy bruising, and loss of consciousness. Dengue fever has an approved vaccine called Denguevaxia. The vaccine is only approved for children between 9 and 16 years of age, who have been previously infected with dengue, and are residing in dengue-prevalent areas. There is no specific antiviral treatment for dengue fever. The available treatment is mainly palliative, and aims to relieve the symptoms and prevent dehydration. The treatment of mild dengue fever may include 1. Adequate rest and fluid intake, to stay well hydrated. 2. Acetaminophen, to reduce fever and pain. Aspirin and ibuprofen should be avoided because they can increase the risk of bleeding complications. 3. Oral rehydration solution (ORS) or intravenous fluids, to replace lost electrolytes and prevent shock. On the other hand, severe dengue fever requires urgent hospitalization and intensive care, and treatment may include 1. Intravenous fluid and electrolyte replacement, to prevent dehydration and shock. 2. Blood transfusion, to replace lost blood, and improve oxygen delivery to vital organs. 3. Blood pressure and vital signs monitoring, to detect signs of deterioration or improvement. 4. Oxygen therapy, to support breathing. 5. Antibiotics, to prevent secondary bacterial infections. Rift Valley fever (RVF) is a viral zoonotic disease that affects both animals and humans. The disease is caused by a virus called Rift Valley fever virus (RVFV), which belongs to the family Phanuiviridae. RVF is endemic in Africa and the Arabian Peninsula, where it causes outbreaks among livestock and humans every few years. The disease is transmitted by various species of mosquitoes, mostly Aedes and Culex mosquitoes, that carry the virus from infected animals to other animals or humans. RVF can also be transmitted by direct contact with the blood, fluids, or organs of an infected animal, and as such, the disease can be contracted through the consumption of undercooked, or raw meat or milk, from infected animals. Depending on the severity of the infection, and the organ affected, a person can suffer from either ocular RVF, meningoencephalitis, or hemorrhagic fever. Without prompt and proper medical treatment, ocular RVF can lead to permanent blindness, meningoencephalitis can result in serious neurological disorders, and hemorrhagic fever can lead to death. The symptoms of RVF usually appear within 2 to 6 days after exposure to the virus. The symptoms can be mild or severe, and they vary depending on the type and severity of the infection. The mild symptoms of RVF include flu-like fever, headache, muscle and joint pain, nausea and vomiting, chest and abdominal pain, loss of appetite, sensitivity to light, and stiff neck. The mild symptoms usually resolve within a week without any complications. However, about 8% of patients who recover from the mild symptoms usually develop severe symptoms within a few days. The severe symptoms of RVF include blurred vision as a result of lesions in the retina, severe headache, breathing difficulty, loss of memory, hallucination and confusion, vertigo, convulsion, lethargy, behavioral changes, loss of consciousness, liver impairment, jaundice, blood vomiting, bloody stool, bleeding under the skin, skin rash, nose and gum bleeding, heavy menstrual bleeding, venipuncture, also known as injection sites bleeding, and acute renal failure. The severe symptoms have a mortality rate of about 50%. Survivors of the severe symptoms may have permanent vision loss or neurological damage. Currently, there is no specific antiviral treatment for Rift Valley fever. Healthcare providers will usually recommend symptomatic treatment to relieve the symptoms and prevent complications. The treatment may include 1. Adequate rest and fluid intake, to prevent dehydration. 2. Paracetamol, to reduce fever and pain. 3. Oral rehydration solution, or intravenous fluids, to replace lost electrolytes and prevent shock. 4. Blood transfusion, to replace lost blood and improve oxygen circulation. 5. Oxygen therapy, to support breathing. 6. Dialysis, to support kidney function. 7. Antibiotics, to prevent secondary bacterial infections. The best way to prevent Rift Valley fever is to avoid exposure to infected animals or mosquitoes. The preventive measures include 1. Avoiding contact with infected animals and their products. 2. Putting on protective mask while at abattoirs or around infected animals to avoid breathing in contaminated air. 3. Cooking meat thoroughly and pasteurizing milk before consumption. 4. Wearing gloves and protective clothing when handling animals or their products. 5. Using insect repellent, wearing protective clothing, and sleeping under mosquito nets. Chikungunya is a viral disease that is caused by a virus called Chikungunya virus, which belongs to the family Togaviridae. The virus is transmitted to humans by female mosquitoes of the genus Aedes, especially Aedes aegypti and Aedes albopictus. The disease is endemic in Africa, Asia, and the Indian Ocean islands, where it causes sporadic outbreaks among humans every few years. Chikungunya can also occur in other regions where the mosquito vectors are present, for example Europe, America, and Australia. The chikungunya virus multiplies rapidly in the bloodstream of an infected person after being injected through a mosquito bite. Symptomatically, chikungunya shares some similarities with dengue fever and Zika virus disease, and so it can be easily misdiagnosed as any one of the two, especially in areas where the diseases are common. Chikungunya can only be properly diagnosed by a blood test that detects the presence of the chikungunya virus or its antibodies. The symptoms of chikungunya usually appear within 2 to 12 days after being bitten by an infected mosquito. The symptoms can last for a few days or weeks, and may include sudden fever, joint pain, swelling around the joints, muscle pain, headache, nausea and vomiting, fatigue, skin rash, and general weakness of the body. These symptoms can be mild or severe, and can cause significant disability and reduced quality of life. The joint pain can persist for months or even years in some cases, and complications such as eye, heart, and neurological problems can occur. The complications can be more severe in very young or very old people, as well as people with health issues such as diabetes, hypertension, or rheumatism. The mortality rate of chikungunya is low, but deaths can occur due to complications or co-infections. Prevention is the best cure for chikungunya, as there is currently no specific antiviral treatment for the disease. Healthcare providers administer treatment, mainly to relieve the symptoms and prevent complications. The treatment may include 1. Adequate rest and fluid intake, to stay well hydrated. 2. Paracetamol, to reduce fever and pain. 3. Oral rehydration solution (ORS) or intravenous fluids, to replace lost electrolytes and prevent shock. 4. Antihistamines or steroids, to reduce inflammation and swelling. 5. Antibiotics, to prevent secondary bacterial infections. West Nile fever is a viral disease, which is also known as West Nile virus disease. The disease is caused by a flavivirus that is transmitted by the Culex mosquito. West Nile fever is endemic in Africa, Europe, Asia, and the Americas, where it causes sporadic outbreaks among birds, animals, and humans every few years. The disease can also be transmitted through blood transfusion, organ transplant, and from mother to child during pregnancy, childbirth, or breastfeeding. West Nile fever is usually mild and asymptomatic in most cases. However, the disease can be severe in some people and may cause neurological complications such as encephalitis, meningitis, or acute flaccid paralysis (AFP). Severe West Nile fever can be fatal if not treated promptly and properly. People who are older than 50 years or have underlying health conditions such as hypertension, diabetes, kidney diseases, or cancer are more prone to severe West Nile fever. The symptoms of West Nile fever usually appear within 2 to 14 days after exposure to the virus. The symptoms can be mild or severe, and they vary depending on the type and severity of the infection. The mild symptoms of West Nile fever include fever, headache, body ache, fatigue, skin rash, vomiting, and diarrhea. These mild symptoms usually resolve within a week, without any complications. However, about 1% of patients who are infected with the virus usually develop severe symptoms within a few days. The severe symptoms of West Nile fever include high fever, stiff neck, severe headache, disorientation, tremors or muscle jerks, muscle weakness or partial paralysis, seizure, and stupor or coma. The severe symptoms have a mortality rate of about 10%. Survivors of the severe symptoms may have permanent neurological damage or disability. Currently, there is no specific antiviral treatment for West Nile fever. Healthcare providers administer antipyretics, analgesics, and fluids to relieve the symptoms of the disease and to prevent complications. Prevention remains the best cure for West Nile fever. Japanese encephalitis virus infection, JEVI, is a viral disease that is caused by a flavivirus that's related to those that cause yellow fever, dengue fever, West Nile fever, and Zika virus disease. The disease is transmitted to humans by Culex tritaniarensis. JEVI is endemic in Asia and the western Pacific Islands, where it causes epidemics among pigs and humans every few years. The disease can also occur in other regions where the mosquito vectors are present, for example Australia and Hawaii. The Japanese encephalitis virus multiplies rapidly in the bloodstream of an infected person after being injected through a mosquito bite, and then spread to other parts of the body, including the spinal cord and the brain. Once the virus gained access into the brain cells, it disrupts, infect, and destroy them, causing serious neurological problems. You can prevent getting infected with JEVI by avoiding exposure to mosquitoes and infected pigs or any other animals known to harbor the Japanese encephalitis virus. People with mild JEVI rarely experience any symptoms. However, in cases where symptoms develop, they usually appear within 5 to 15 days after being bitten by an infected mosquito. These symptoms can be mild or severe, and they can cause significant disability and reduced quality of life. The mild symptoms can last for a few days or weeks, and may include fever, headache, neck stiffness, muscle weakness, nausea and vomiting, and fatigue. About 1 in 4 patients who are infected with the Japanese encephalitis virus develop severe symptoms within a few days. The severe symptoms of JEVI include high fever, severe headache, disorientation, coma, seizures, and spastic or partial paralysis. The severe symptoms have a mortality rate of about 30%. Survivors of the severe symptoms may have permanent brain or neurological damage, such as recurrent seizures, paralysis, inability to speak, and permanent intellectual dysfunction. Currently, there is no specific antiviral treatment for Japanese encephalitis virus infection. The best healthcare providers can do is administer palliative treatment to relieve the symptoms of the disease and prevent complications. However, there is an approved vaccine for the disease, which is called JEVAX. The vaccine must only be administered by a qualified medical doctor or under their direct supervision. Therefore, if you are planning on visiting places where JEVI is prevalent, and you will be staying for about 4 weeks, make sure you consult your doctor for recommendations on getting vaccinated against JEVI. Zika virus disease or Zika fever is a viral disease that is caused by a virus called Zika virus, which belongs to the family Flaviviridae. The virus is transmitted by female mosquitoes of the genus Aedes, especially Aedes aegypti and Aedes albopictus. The disease is endemic in the Americas, Asia, and Africa, where it causes sporadic outbreaks among humans and animals every few years. The disease can also be transmitted through sexual contact, blood transfusion, or from mother to child during pregnancy or childbirth. The disease can only be diagnosed accurately by laboratory tests conducted on body fluids, such as blood, urine, saliva, and semen. While Zika virus disease is usually mild, it can cause severe neurological complications in rare cases. The symptoms of Zika virus disease usually start within 3 to 14 days after being bitten by an infected mosquito. The symptoms are mild and can last for about 2 to 7 days. The symptoms may include fever, headache, muscle and joint pain, conjunctivitis or red eyes, skin rash, and general weakness of the body. There is currently no specific antiviral treatment for Zika virus disease, but with proper medical care and attention, it usually goes away on its own without any serious or lasting effects on the patient. Individuals who contract the disease are advised to stay hydrated, get plenty of rest, and treat the symptoms with medications recommended by their doctor. However, complications can arise sometimes, especially for pregnant women, as Zika virus disease has been linked to congenital malformations and other birth defects in babies, such as microcephaly, brain damage, eye problems, hearing loss, and impaired growth. Complications in adults can lead to a rare neurological condition known as Guillain-Barré syndrome, which causes muscle weakness, paralysis, and sometimes respiratory failure. Prevention remains the best cure for Zika virus disease. The preventive measures you can take against getting infected with ZVD include 1. Avoiding direct physical contact with infected mosquitoes or people. 2. Avoiding sexual contact with people who are infected, or may be infected with Zika virus. 3. Using condoms correctly and consistently. 4. Making sure that blood is properly screened before transfusion. And 5. Not visiting areas where Zika virus transmission is ongoing, if you are pregnant. Thanks for watching.